Hello everyone. Today is the fourth session of She Matters series, and I have dedicated the fourth and fifth session to 30 to 40 years age group females. Today we'll be talking about the gynecological diseases, and tomorrow we'll be talking about pregnancy. So, the most common gynecological disorders occur during this age group. This is the reproductive age, 30 to 40 years. The common disorders are like fibroid, adenomyosis, endometriosis, etc. Now, what is fibroid? Fibroid is a benign tumor, also known as leiomyoma. Many times in ultrasound, we do get patients saying that, "Ki ma'am, chota sa fibroid aaya hai, do I need to get a surgery done?" No, fibroids are basically benign tumor and they are very common. If in ultrasound there are small seedling fibroids, they are not affecting you, you do not have any menstrual irregularities or any other problems, no need for treatment. If there are menstrual irregularity, you are having heavy bleeding, painful period, in between the periods you are having bleeding or spotting, you are having pressure symptoms because of that fibroid causing pressure on the bladder or the rectum and having constipation, infertility. So these are the issues when this fibroid needs treatment. Second is endometriosis. As we discussed, endometriosis was there in 20 years also, but mostly the patients come at 30 years. The reason is the most common theory for endometriosis says that there is retrograde menstruation. That means जो period का blood flow है वो उल्टा fallopian tube से जाता है throughout the peritoneal cavity. Now what happens? It starts early only, but with time it progresses, and there is chronic low-grade inflammation in these implants, endometrial deposits that cause adhesion formation, and by the time the patient reaches the age of 30, 32, 35 years, she has severe pain during periods. That's called dysmenorrhea. Most of the times these patients are also associated with infertility. So actually when we do the infertility workup, we find out that the patient is having endometriosis. Third is adenomyosis. Adenomyosis, अगर आपने अल्ट्रासाउंड में कभी देखा है, बहुत लोग बोलते हैं bulky uterus. Now what is this bulky uterus? Post delivery, sometimes the uterus can be bulky, but if it is associated with painful periods, severe pain during periods, when we do the examination, we see a globular uterus and there is tenderness also on examination. This is a disease called adenomyosis. Now, two important tips. Nowadays, there is increased trend of late marriages, and if the marriage is early, still the people are planning pregnancies very delayed. So that is the reason the infertility incidence has increased so much in our country. It's not only about infertility. One more thing it is associated with. There are two things. After the age of 30 years, the ovarian reserve, there are two ovaries and there are fixed number of ovarian follicles inside these ovaries. So the ovarian reserves keeps on reducing, and side by side the risk of congenital anomaly in the fetus keeps on increasing with the maternal age. So please plan your pregnancies accordingly and timely. Thank you.